some women are on that roller coaster and want to get off and can't get off, and other women who are perhaps less stressed and have perhaps a healthier diet, or don't over exercise. The different variables in what women are doing that can determine how rough that roller coaster ride gets.
Stay tuned as I share this helpful interview. Hi, I'm Natalie Up, owner of Fired Up Fitness and the creator of the Mom Bod Tune-Up. On this channel, I help midlife women improve their transition through menopause with tips on natural hormone support and weight loss to look, feel, and live better. If this sounds like you, be sure to subscribe and share this video with your friends. So, not to throw my husband under the bus again, but I do love him dearly. But he's got his eye roll things for me that he's like, that doesn't make a difference. So in this case, it's like with our cleaning products, and I'm like, I pretty much switched out now. I think I have every single beauty product is done. Good. Switched out over the years. Cleaning products, I think I'm pretty much there as well. And one of the last things I just did this summer actually was finally like, he was majorly rolling his eyes at me when I got the Clean People laundry detergent sheets, and they're totally non-toxic and everything, but they're these, like, they look like sheets, like almost pieces of paper that you stick in versus like a pod, like his Tide pods.
Yeah.
And he's like, there's no way that's a thing, like, and he's like, doesn't believe me. So can you tell the audience why it is important to be switching out these products and focusing on not using all of these chemicals and so forth, and what how they affect our hormones?
Okay, well, one thing I do want to say is that the Cosmetic Safety Act has not been updated in 80 years. Yikes. So we have at least 1,400 chemicals, man-made chemicals, that are present in our personal care products. The makeup we slather all over our face, the moisturizers, the creams, the hair products, the shampoo, all of these things that, in fact, over here in Europe, most of them are banned. There are 1,400 chemicals that we still allow in our products in the United States that are not allowed over here.
Wow.
And, you've heard of forever chemicals, the parabens, the PCBs, the phthalates that are in your shower curtains, all that stuff that's in the detergents, the sulfates, etc., that your husband's rolling his eyes at. So all of those qualify. Heavy metals, and we have heavy metals in our eyeshadow. We have lead in our lipstick. All of these things are they come under the classification of endocrine disruptors. So the hormone system is the endocrine system, and hormones have their rhythms. We've been talking about cortisol has a rhythm. Estrogen is produced in the first half of the follicular cycle. Progesterone's produced upon ovulation. We have cycles. Women much more so than men. We have a lot more of an infradian cycle, in fact.
Does it still affect them though? I mean,
yeah, absolutely. Because the thing about these chemicals that they have realized is that they live in our environment forever. They get into the cells, into the fatty tissue, into the breast tissue. I mean, women breast milk has been shown to have flame retardant in it.
Oh my gosh.
This stuff it's chemicals. They're called xenoestrogens in particular. Xeno meaning foreign or man-made, unnatural to the body. The thing about them is that they can occupy the receptor site of a cell and mimic a natural estrogen or a natural hormone. So sometimes you hear of these chemicals being called estrogen mimickers. So what that means is that I have to explain a little bit about hormones work. So hormones are carried in the red bloodstream. They're carried on a red blood cell by a binding protein called a globulin. It's the sex hormone binding globulin so it binds the hormone to the red blood cell. So those hormones are kind of inactive, but there always is a signal from the brain saying, hey, she's over there lifting weights. We need some testosterone in the tissue. So now this bound testosterone, a fraction of it is going to become unbound and leave the bloodstream and move into the tissue, where you have tissue is collection of cells. So every cell has receptor sites on it. So if you think of a receptor site as like a helicopter landing pad or a dock or something, these hormones actually travel to their specific hormone receptor and they lock in. So we talk about the hormone is the key, the receptor site is the lock. It's like a lock and key effect. Sometimes it's called binding. I think of it as a puzzle piece. You know, when you put a puzzle piece in and it fits perfectly, that's what hormones do. They fit perfectly on that receptor site. The problem is, and then they, you know, that receptor site opens the door and unlocks the door, and the hormone goes in and does its thing, governing our mental, physical, emotional function. The problem with these chemicals that are in our detergents and in our cosmetics and, you know, all these chemicals are, they can mimic that estrogen. So they can actually displace a naturally occurring estrogen because they're so potent. They're much more chemically, environmentally toxic than our own hormones. And they can actually, it's like if somebody shoved you off the chair that you were sitting on and said, I'm sitting here. You know, these hormones will actually push out a naturally occurring hormone and occupy the receptor site and overstimulate it. And it's like the guest who doesn't leave, you know, it's like they never, you can't get rid of them.
Yeah.
And they overstimulate the cell and create a constant overproduction of estrogen that isn't even natural estrogen. You know, it's sort of like they're jamming the door open but not creating the right function. They're overstimulating function. So now we become estrogen dominant. That matters a lot in terms of all of the ill health effects of estrogen dominance for women. You know, the long game is breast cancer, uterine cancer. If you have too much estrogen and it's constantly churning in your system, you're going to move through all those disorders, the heavy periods, the fibroids, the cysts, whatever it's going to be. Women, you know, end up getting hysterectomies because they have too much estrogen and they don't realize that all these products they're using is causing it. And these things are in our personal care, our gardening products, our cleaning products, so you know, our couches that are sprayed with the Scotch Guard. So, you know, it really becomes a process of looking under the sink. Just recently, I found some Comet under the sink. It was like, what are you doing under there? Because we're lucky. We have lots of good choices now. We have
so
natural,
many good choices. Yes.
We're very lucky now. We can, you know, nobody's saying get rid of all this stuff right away, but it's a gradual cleaning out, as I'm sure you've been through. The other biggie is eating organic. And I know not everyone can afford that, but at least making sure that the beef and the pork and the ham or, you know, chicken that you eat does not have hormones in it. Because these animals are I don't think chickens are as much anymore, but I think they put hormones in the feed sometimes in these factory farms. Why? Because it's all estrogen again, to make the cattle grow fat faster, to make the dairy cow, you know, so you get more meat to the bone, you get more milk to the, you know, they're keeping these animals jacked up with hormones so that they produce more faster. And, you know, it becomes, we all have an overload. Why do we think that young girls are getting their periods at 9 years old? They have too much estrogen. Why are men getting, you know, men, what is it? I was just reading. I can
like
read
man boobs and stuff. Is that what you mean?
And prostate cancer. And there are all kinds of reproductive disorders in males now, and a dropping sperm count worldwide. Like I was just reading the sperm count has, I got to get this note. In the past 30, the incidence of disorders of development of the male reproductive tract has more than doubled in the past 30, 50 years, while sperm counts have declined by about half.
Wow.
That's pretty significant. And men are getting, you know, men don't realize when they are exposed to the xenoestrogens and all these chemicals, what's happening to them is that all that estrogen is depleting their testosterone. You know, when you have, for men, it's estrogen is high, testosterone gets low. And as men get older into their 40s, their testosterone's declining naturally anyway. And the estrogen that they have, which is much less than women, we all share the same hormones. But we women have more estrogen and progesterone, men have more testosterone and less estrogen. The ratios start to shift.
Mm-hmm.
And I don't realize, and especially men that are overweight, they can have that conversion in fat cells where more estrogen is being made, churned out, and it's being converted from testosterone. So a lot of men will go get, they think they're low in testosterone because they're getting erectile dysfunction, or they're depressed, or they're moody, or they're gaining weight, and all kinds of things, and they don't realize what's happening. They think, oh, I just need a testosterone injection, and that can make it even worse, especially if they're overweight, because the testosterone gets converted to estrogen. So
complicated.
The estrogens and chemicals, though, really need to be avoided by men. I've tested men who have really high estrogen levels and low testosterone, and they're only like 45, and you find out they really like milk. So they drink tons of milk and dairy. They like dairy a lot, and they're not cognizant of the fact that there are these hormones in the milk. So the cure is choose the milk that says our cows are happy cows. They're not given hormones. Choose the meat and the chicken that says we do not add, might say no artificial hormones. That's what you're looking for.
Mm-hmm.
It doesn't necessarily have to be organic, but it has to say no artificial hormones. Choose the non-toxic. I don't know what you use, Natalie, but Beauty Counter has made a big effort to create non-toxic cosmetics. And in fact, they're up on Capitol Hill lobbying to get the Cosmetic Safety Act updated, which is more power to them. Thrive Cosmetics is a good one.
Most of mine, I use a combination, but I use a lot of, the most of Thrive. And then I also like Ilia for my foundation, but Thrive is, the majority of my makeup is Thrive.
I like Thrive's the mascara and I also like, and their eyeliner. I also like Just Ingredients. They have some lovely moisturizer things. So I mean, really, women, we don't want to be using chemicals in, unknowingly and unwittingly. And since these cosmetic companies don't have to report what's in their formulations, we don't know. I mean, it's not that we're being stupid. It's just that we are being uninformed. So, but we can inform ourselves and make better choices. But back to the husband thing, he, it's good to understand that these problems with male sperm counts and testosterone lowering, there was a big study called the HIM study, hypogonadism in men, which refers to low testosterone. And they found that almost 40% of men who presented at clinics with symptoms of malaise, erectile dysfunction, low libido, different things, weight gain and all that, had low testosterone. And most of them, even in their 40s, and higher estrogen levels. So if you're getting your estrogen from chemicals in the environment, why not be aware of it and start? Everything you're doing is what you need to do.
Well, and how long does that typically make a difference? Like once we are, I've been at it for several years now, getting those products out, but how long does that take to get out of our body and make a positive difference?
Well, I mean, I think, these things start to pay off right away. If you're metabolizing estrogens out of your system because you're eating a lot of cruciferous vegetables and you're not you're avoiding xenoestrogens as best you can, and you're making sure that you're not doing anything to disrupt your normal processes, and you're sleeping well, and you're eating enough protein and good fats and fiber and vegetables. Fiber, of course, being so important for flesh, for also ridding the body of excess estrogens, because estrogen, when it gets high, tends to recirculate in the system. So,
and that's another thing that I've I'll admit that I have gotten lax on, but I've been in the last month been really trying to get back on that. But yeah, it's because it's hard to like really focus on getting enough fiber.
And we need that fiber to keep our, not only to keep the digestive tract regular, but to help the liver metabolize these hormones. You know, the whole system, just to have better digestion and get rid of this stuff so it doesn't pile up and cause, who was I talking to the other day, has diverticulitis. I mean, you know, these things are because of a lack of fiber.
Right.
And so insulin resistance, where people start to get, you know, really imbalanced with their blood sugars and gaining weight to the point where they just can't lose. And that's the, you know, the lead up to diabetes.
Right.
These things are all preventable. We just have to be aware. We have a symptom quiz at yourhormonebalance.com where you can go and look at all this, you know, go through the symptoms. And so many people will say to me, I didn't realize those were symptoms of imbalance. I just thought it was normal to have horrible periods, or, you know, everybody in my family had a hysterectomy, so I did too. You know,
I'll put the link in the description on that quiz. I think that would be helpful.
Symptom awareness is a big deal. Knowing the symptoms of imbalance is the beginning.
Absolutely. Okay, well, speaking of chemicals and so forth, at least I think about it like this. So my research anyways has led me to be in the camp of, especially after 40, and I know that it's hard to say prior to that, but especially after 40, women really should not be on birth control pills. And I don't know, especially, or IUDs that have hormones in them. But I have so many people that come to me as either new clients or just like, or our clients, and, you know, they're so afraid to go off of their birth control pill that they've been on forever and ever, because prior to going on, you know, they had the horrible periods and they're just, I mean, they're like, I can't, you know, imagine like having to go through the cramping and all the things again. But I'm not a doctor. And so I'm, you know, I can only provide the education, you know, that in my recommendations. But what's your take on that? And what would you say to somebody that came to you, you know, talking about that?
Well, you know, I had to really get brave on that one, because I would say that I was probably one of the first in line when the birth control pill came out in the 60s.
Well, I mean, I was on it too. So, I mean, I get it.
Yeah, we women have, you know, the big default. If you have acne or heavy periods or mood swings or PMS, you're put on the birth control pill, and you still are. And it's still the default. And I test women who are on the birth control pill and their hormones look like they're in menopause, and they've got the symptoms to go with it. And, you know, these hormones that are in birth control are the same as in HRT. They are synthetic. They are xenos. They are endocrine disruptors. They are bad mojo. They're dangerous. And, you know, it's really, and women who are using them to deal with the symptoms of hormonal imbalance. And so if we're aware that if we have acne, if we have heavy periods, what hormone imbalance is that linked to? And let's test and resolve that issue. A lot of women that have acne and oily skin and irregular periods and irregular moods and irritability, they have PCOS, they have polycystic ovarian syndrome. That is often linked to a history of eating lots of carbs and lots of sugars that create a surplus of sugar in the body. Insulin has to come out to deal with that sugar, and you get this situation where people have a high insulin level. What happens when insulin remains high is that it causes the ovaries to churn out excess testosterone and DHEA, and that causes oily skin and acne. And so if you know this, and you know you're 50 years old and you're still on a birth control pill, and I've talked to many of those women, because they are afraid they're going to get adult acne, or they're going to get, you know, no, it's knowing, it's symptom awareness. As I said, if you took 52% of women that are on birth control are not even using it for contraceptive purposes. They're using it for trying to deal with these hormonal imbalances that they don't realize are hormonal imbalances that can be balanced. And a lot of doctors will say, oh, you can't test your hormones. They fluctuate all the time. There's nothing you can do about it. Just, you know, but if you know the symptoms and you realize there's an imbalance and you know that there are things out there that can help you rebalance, supplements, adaptogens, and lifestyle changes and dietary changes that aren't, is it terrible to have to eat more healthy protein and,
No.
and have a healthy smoothie with some turmeric powder in it, and maca
Right.
adaptogen and some lovely nut butter and some, it's not a hardship to switch over to hormone balancing. You can rebalance your hormones without birth control. And people who are worried about getting pregnant, we are so lucky now. It's like we have all the choices with non-toxic products. Now we have fertility trackers and family awareness methods. Alyssa Vitti is a brilliant person who wrote the Woman Code and In the Flow, and she has a flow tracker. There's Natural Cycles flow tracker. You can actually see when you're fertile, and it's not that hard to switch to a method that lets you become much more aware of your cycles and of your body, and helps you embrace what what it is to be female, and to be, most women also, as we get older in menopause, you don't really need to worry about getting pregnant. Not after 50, not after menopause. No way. You're not ovulating.
Well, do you truly need, though? I did read, to be safe, like a full year after you hit menopause, that you're truly out of the woods, if you will.
Yeah, because well, if you're not ovulating, you're not going to if you don't ovulate, you're not releasing an egg, then there's no egg to be fertilized. So no worries there, but
it just still makes me nervous.
Well, you just I would do the tracker and make sure that you're
no, in which I haven't been on.
I would advise people to track their ovulation, and if you are still ovulating, then use, just, what is it, 5 days you can become pregnant in the whole month, that you can defer on those 5 days as long as you know when they are and you're on top of that. And then there's the IUD, the copper IUD is a lot easier for women who've had children to deal with. Once you're what they call nulliparous women who've never been pregnant sometimes have more pain and cramping with the copper IUD, but it's a non-hormonal form of birth
control. And that doesn't
control.
have anything to do with heavy metals or anything with the copper, like that's fine.
Yeah, evidently it's it doesn't seem to be a problem, but it's not it's the one form of IUD that is non-hormonal. It wouldn't be my favorite choice. I would rather do fertility tracking. And I think since women have that method available to them, to check it out. We have a lot of information on our website. Alyssa Vitti is, again, as I said, but I think there are way better choices, and there are really heightened risks for breast cancer and all kinds of issues with long-term use of birth control. Some women, I've talked to so many women that were on them since they were 15 and now they're 32 and they're getting married and they want to have children and they can't even get their period back. But they can once they get off and get on some progesterone. Progesterone is actually the pregnancy hormone.
Right.
It takes that pregnancy to term, especially crucial in the first 12 weeks of pregnancy.
I had to take that for one of my pregnancies.
Yeah, there's a big risk of miscarriage with low progesterone, because progesterone is the hormone that starts to rise dramatically the minute there's a fertilized egg. That progesterone swings into action, starts feathering the nest, creating all these secretions that allow that embryo to implant firmly so you don't lose it in that first trimester. And then progesterone continues to, the baby is swimming in a sea of progesterone towards the end of the pregnancy, and which is why with delivery and all of it goes out with the placenta, some people become pretty, postpartum depression can be a symptom of that loss of progesterone also. But we have so many good choices now. I just don't think that, the hormonal birth control should be in the picture, nor should HRT, synthetic HRT, when we have plant-based hormones that actually fit on that receptor site, like the puzzle piece that I was talking about, that fit perfectly. Yes, they're synthesized in a lab, but they're made from plant materials and they're made to be the exact structure and function of our own hormones, the hormones our bodies make. Big pharma can't duplicate that because they can't create a patent. There's no patent, no profit. You know, they can't make a natural hormone. They have to change the molecular structure. So again, that becomes a xeno. It becomes something that's going to disrupt the natural endocrine order of things.
Obviously, I'm trying to push people, and you guys are too, I think, you know, to make the lifestyle choices and these behavior changes, you know, with nutrition and mindset and sleep and stress and all the things. I mean, those have to happen. I mean, so many people don't want to change, but we're not going to be, you cannot feel better if you don't make the changes. Would you agree? I mean,
it's pretty hard. And I mean, my mentor, Dr. Zava, I learned so much from him and all the functional medicine doctors that I worked with and compounding pharmacists. And, you know, they will tell you, you are not going to age well. You are not going to prevent symptoms, unwanted symptoms, disorders, and even disease if you are chronically out of balance for years and years and years. I really think people don't know how much better they could feel. They don't even remember how much better, how they used to feel. And we now have these plant-based hormones, which we never suggest anyone take without testing. And that's another issue that I've talked to too many women who've been put on hormones, and sometimes they're bioidentical. Okay, that's good, but they weren't tested. You know, to test your levels is the first know the symptoms. If you think you have symptoms of imbalance, and we know that you do when you're in perimenopause, because that's the inevitable fluctuation. It's going to happen. We are not going to ovulate forever. We are going to go into menopause. And by the way, we're in menopause forever. We don't go through menopause. That's where we are.
Right. We just stay.
And that's where hormone replenishment becomes important, because we're living to be 80 or 90, because we want to protect our heart and we want to protect our bones. And by the way, I didn't say that women like yourself, Natalie, who are thin and have fair skin, et cetera, well, your estrogen isn't low right now, but testing, if your estrogen is low, that's important to protect the bones. Get a DEXA scan. Be sure that you're using a balanced blend of estrogen and progesterone. Younger women who are not in, you know, women all through perimenopause can often just use progesterone to balance the ups and downs. But this is all based on testing. And the testing we do is in saliva. There's other testing. There's dried urine testing. There's blood testing is not great, because the standard blood draw is measuring those hormones that are in the bloodstream. It's not measuring the ones that have become active, you know, that have become unbound and moved out of the bloodstream into the tissue where hormones do their thing. And we can capture those active, what we call bioavailable hormone levels in saliva, in salivary gland. And that tells us a whole lot more about what our hormones are actually doing. You know, how are we low, are we high, which ones are, and then we link that to the symptoms. So saliva is great that way for testing active hormone levels. It's non-invasive, which is major, because in fact, it's the gold standard for testing those cortisol levels, your adrenal function, because you have to know morning, noon, evening, bedtime. You can't get a blood draw 4 times in one day.
Right.
And for many people, blood draws are very stressful. So they skew, you know, needles are very stressful. So you need non-invasive testing to get a good look at what your cortisols are doing without, you know, stressing them out from a needle. So that's,
is there a better time on your menopause journey to do this? Like, this was the first time I had done this, you know, but
well, that's the other thing with saliva. It's a home test kit. So you're going to spit in a tube and collect your saliva at the right time of the month. So for people who are still having cycles, that means that you're testing at a particular time in the cycle, right between the follicular and the luteal phase. So that's around day 19, 20, 21. So if the first day of a menstrual cycle is, let's say you started your period on October 1st, you would test your hormone levels on the 19th, 20th, or 21st. Those 3 days are going to give a kind of perfect peak. We want to see when hormones are at their best.
Okay.
Best shot. A woman in menopause who's no longer cycling can test any day of the month. But with the cortisols, you do have to test. There are 4 tubes in the kit because we want you to collect in the morning when you first wake up, and all the directions are in there. It's before you eat, before you drink, before you exercise, floss your teeth, any of that. You want to rinse your mouth and just start spitting into the tube, half a tube minus bubbles. And you can drink a lot of water the day before. Hydrating helps to get the saliva up. Some people have dry mouth. And then you have to collect it at noon. So I always say before lunch. So right after, before breakfast, before lunch, before dinner, and then at bedtime. And in that way, in the morning collection, we're looking at estrogen, progesterone, testosterone, DHEA, and morning cortisol. And then the other 3 are looking at the noon, evening, bedtime cortisol. So, and all those show up in the test result. And then there's a whole comment field that tells you what's going on, and which is very academic. So that's why we like to counsel people so we can educate them and review things. And then it also ties, we collect symptoms in the testing so that we can marry the symptoms back with the hormone levels. And most people are just like, oh my God, thank God I get it now. This isn't in my head. I wasn't making this up. This is really, look at my level. No wonder my nails are peeling and breaking and I have vaginal dryness. Or, so it's really very helpful. Most women are, if there's nothing wrong, they're really depressed. They're really, and there's always something. There's always something going on. Yeah.
Well, and then if they were, go ahead.
I was just going to say, by the time women get to the awareness, and by the way, many women I've been doing this for so long, and there's so much greater awareness now. It's really gratifying. But by the time women get to the place where they think, I'm suspecting I have an imbalance, I need to test, they have, they have symptoms, and that it's going to show up in the testing.
Well, and if they were going to do something, and it was so easy to get that. I got the kit in the mail, and like you said, I did all of that. So that was like so convenient. If somebody wanted to take the route of going, being an in-person, like a doctor or whatever, should they be going to a gynecologist, a functional doctor? Like who are they going to then maybe to like follow up, and if they're wanting to do bioidenticals and so forth too?
Right.
And who are they going to?
and may I say, insist on bioidenticals. So you are not.
Gosh, yes. I'm even like, I have not been like, yes, go bioidenticals and do that from the beginning, because I see there's so many things that you can, and I myself found there are so many things that I could help. Now I can see where now I'm getting to the point I'm like, oh, I wonder how long these things are gonna, that I can help without any progesterone or whatever. But that being said,
it's good to go. I think one of the first places to start is adrenal support, because, which means relaxation and not doing all the things that keep you like a stress bunny all the time, emptying the old stress bucket. By the way, the adrenals take over all hormone production when we're in menopause. They pick up the slack from the ovaries. So as the ovaries, as the curtains are drawing to a close on the ovarian function, here come the adrenals, and now they have to regulate your blood sugar and insulin, your sleep-wake cycle, your immune response, and now they have to be the main source of your hormones.
Oh my God.
This is where women really need to get their act together in terms of self-care. This is the time. Give yourself tender, loving care. And that's a great place to start. Someone like you can help people enormously. Just get their adrenals in balance, their blood sugar in balance, create a balanced lifestyle, a balanced exercise program that has high intensity and low intensity. It can't be all high impact stuff. But then when the time comes and you're really in a place where your ovaries have packed up, they're not doing much. You're going to live to be 60, 70, 80. You've got to replenish, and what you're replenishing is not huge doses. We're not trying to be 25 again. I'm not trying to compete with my daughters when I use hormones. I'm using just the physiologic amount my body required, to keep cylinders in, keep
Mhm.
me running on all cylinders. And I think, you know, I'm 75 years old now. I've been using hormones for quite a long time. And I have a podcast too called Women Talking Frankly, WTF.
Oh, I've listened to it. It's great. I loved
Well,
it. Yeah.
Kyle McAvoy is my good buddy. She was actually our top, when I was at ZRT, I was the director of education there. But when I was there, she was our top provider in Portland, Oregon. She's been doing using bioidentical hormones with her patients for at least 20 years. And there are many, many practitioners out there. So when you ask that question, I think you can go to ZRT's website. They have a physician referral. You can look in your
Mhm.
area with a zip code and see. So all the lists of people there are people trained in functional medicine doctors. We're talking about integrative medicine doctors. Many naturopaths are very savvy about this. We have tons of naturopaths in Oregon and Pacific Northwest because the best schools are there. And so naturopaths and nurse practitioners are your friend when it
Mhm.
comes to that. And also if you're
One of
in
my
a,
best friends is a nurse practitioner that does this in Colorado, and yes, she's so passionate about it. It's great.
and they know their stuff, you know, they can prescribe these hormones. Also, you can go to a compounding pharmacist in your town because
Mhm.
if you have one in your town, compounders are very savvy. They know who in town knows their stuff. I mean, when I was compounders know who knows how to prescribe. They know which doctors are prescribing properly. They know
Mhm.
which doctors are testing their patients first before they prescribe.
Mhm.
And they know and they often help. Actually, compounding pharmacists are often educating doctors about how to prescribe,
Hmm.
because when HRT became an issue in the Women's Health Initiative, and it showed that, you know, these synthetic hormones were causing harm, a lot of doctors just stopped prescribing them entirely. And that's, they didn't know how to, you know, they just stopped using them.
Mhm.
And so women are really missing out because it's not like we need to go back to synthetics, but we got bioidenticals. They've been using them in Europe for 30 years. Why? But American doctors are not trained. The average OBGYN is not trained in how to use bioidenticals or testing. So if you have an OBGYN that you love that delivered all your babies, and you know, a lot of women are, they love their gynecologist, but
Mhm.
you got to find out, are you in the camp of testing my hormones? Will you use bioidenticals? Because if not, you have to move on. There's also the Institute of Functional Medicine, which is nothing but, you know, doctors trained in this. They have also a physician referral, the IFM.org, Institute
Okay.
Functional Medicine.org has a physician referral. So there are ways. So the compounding pharmacist in your town, the referrals on ZRT Lab and IFM, and you know, just word of mouth, and finding out and interviewing your doctor and asking the right questions is really important.
Mhm.
But I think the resources are out there now. What we do is, I have a mentor in Dr. C.W. Randolph, who has a big clinic in Florida. He was a mentor, a mover, and a shaker in the world of bioidenticals. He's written a lot of books, and he is retired now, but his daughters started a company called Radiate Wellness, and all of his formulations that he used for 30 years with his patients are now available without a prescription because
Oh,
they're
okay.
the lowest effective dose. So for women living in, you know, some little town in Iowa that don't have a compounding pharmacist or a functional medicine doctor
Mhm.
within 100 miles, can benefit from, you know, they can, if they test and they know what they're doing, they can order
Mhm.
online and get a bioidentical plant-based hormone. So things
The
to look
actual
into.
patient can order that. They don't even have to have a doctor order. The person can order it, right?
Well, hopefully no one's
After
already
you've
done
tested.
testing.
Right. Right.
We provide the link to Dr. Randolph's hormones, and, you know, never provide that before I mean, we're all about the testing
Yeah.
first. I'm sure that women do, just like doctors prescribe hormones without testing, but obviously the best way to go is to know
Right.
because you want to tailor the dose to your needs. You know, you don't, it is a physiologic dose. So most people just use one pump, but that provides that 25 milligrams. But some women have been so low for so long, maybe they need a little bit more.
Mhm.
And or so, you know, so estrogen dominant or whatever the testing shows us, we can
Uh-huh.
we can you know, kind of adjust. And also that's where once women start the testing process and using something in that first year, it's really good to retest within a few months to monitor how, you know, to retest while supplementing the hormone and the vitamins and stuff, so that we can see how they're working for you and if is there a change that needs to be made. So it's, you know, it's a process. It's just like with, if you were taking thyroid meds, you would get you have to be monitored, you know, and that's another subject, thyroid and estrogen dominance, big connection.
Oh yeah.
7 out of 10 women have thyroid issues. When do they start? In perimenopause, for the most part.
The amount of people that come through as potential clients on my form that they fill out, I mean, the amount of people that are hypothyroid, it's just crazy.
And, you know, and so here we are back to, you're not ovulating normally because you're moving towards menopause. Your estrogen's getting high, your progesterone's low because you're not ovulating. And guess what estrogen does? It disrupts the conversion of T4, the most abundant thyroid hormone, to T3, the active thyroid hormone. So estrogen actually runs interference. And when women get that test and they're only looking at TSH and it comes back normal, and women are going, but I'm gaining all this weight and I have no energy and my hair is falling out. You're telling me it's normal? No, it's because you aren't testing the T4 and the T3 and the estrogen levels and all of that. So,
I know. I feel you, sister.
Yeah. Thank you for letting us have this conversation, because obviously I can't believe I'm still yakking about this. I should go retire and put my head under a basket, but I just
wealth of information. So I appreciate it.
Yeah. Well, hopefully your listeners will too.
Okay. Well, and then
offer them, anybody that wants to test, we would love to make an offer of, you know, if you go to our website and order a test, do the symptom quiz first. But if you decide to order a kit, use the code Natalie 50.
I think that's what we had talked about. Yeah, and I'll put it in the description.
And then $50 off can be.
Yeah, that's awesome.
That helps.
Cool.
That helps.
All right. Well, it's so great to talk to you again, and really appreciate you filling in my community with more, just being a wealth of knowledge. So.
Well, thank you for having me. It was fun getting to know you a little better, and I'm sure we will say to be continued.
Yes, for sure. Okay.
Thank
you so much.
Okay, bye-bye. You're welcome. Bye-bye.
Bye-bye. Did you like the interview? Make sure you smash that like button, subscribe, and share this video with your friends so they don't miss out on their education about healthier hormones. Well, looks like it's time to go. Hope you're feeling fired up. Bye.